If he was gone, that would be a big problem for me.
During the pandemic, many patients in need of medical transport for diagnostics, dialysis, and other procedures were not getting to their appointments due to a lack of transport services. But one team of retired paramedics began a service to change that. John McKay, a retired paramedic for over 25 years, saw there was an immediate need.
These patients were not getting to their appointments. They were not getting home from Winnipeg when they were admitted for procedures, or they were being discharged and coming back to their own region.
McKay says they made an agreement with the Interlake Eastman Regional Health Association in May of 2022 to provide necessary help. He assembled a team of 16 licensed paramedics who are either retired or off duty. They have since completed over 6,000 medical transports from all across southern, Interlake, and western areas of Manitoba.
The problems were solved.
McKay says they continue to transport patients until the province imposed regulations of the Emergency Response and Stretcher Transportation Act. They were told they couldn't transport patients from hospital to hospital.
The same patient that could be in Eastgate Lodge, a care home in Beausejour, if their doctor decides, you know, we should really get a CT of that abdomen to see what's going on, they're stable, but let's have a look at it. We can transfer them to Selkirk for a CT scan. If they happen to be in the hospital 3 blocks away in Beausejour and a doctor says, yeah, they're stable, let's get them for a CT, we can't take them from the hospital according to the regulators.
McKay and his team continue to make several medical transports every single day, but are doing so privately. 63-year-old Norman Pereski sustained a back injury when he was 21 and is bedridden because of it. Through a stretcher service, it costs Pereski $1,620 every time he needs to go for an appointment. McKay charges $150 for the same service.
It's a reclining wheelchair that I get in it, and it reclines back, and that's how I'm transported. And it's $1,500 cheaper, and I can handle it.
Pereski says he is worried McKay's service will be shut down.
I'd be financially strapped, like terribly financially broke, and just I wouldn't have the convenience of being able to go to all my doctor's appointments.
Shared Health tells City News that a stretcher transport service was launched earlier this year in an attempt to allow paramedics and ambulances to focus on emergencies. A spokesperson from Shared Health did not confirm whether cancellations for appointments has increased. McKay's service, Community Paramedics Service Inc., is not a provider for Shared Health.
I would say that they need to take a real look at even the autonomy that a region has to go about doing its business in healthcare and serving patients, because the patients now suddenly are not getting to their appointments.
In Winnipeg, Alex Karpa, City News.